Hello everyone, thank you for joining and a warm welcome from Geneva to the WHF webinar on the 142nd Executive Board. My name is Jeremiah Mwangi, I'm the Director of Policy and Advocacy at the World Heart Federation, and I'm joined by Alistair White, our Policy and Advocacy Officer. Before we begin, just a note to say that we will include the Advocacy Team email address at the end of the webinar. So if you have any questions during the presentation, please note them down and feel free to follow up with us afterwards. So just to quickly run you through the agenda for today's webinar, we'll start by giving an overview of the Executive Board and the main reasons the WHF's advocacy team will be attending, and some recent changes that have been made to the EB by the new WHO DG, Dr. Tedros Adhanom Ghebreyesus. We'll discuss the items on the agenda of this year's EB, paying special attention to the two main items we will be following: discussions on the draft 13th General Programme of Work and preparations for the third UN high-level meeting on NCDs. Finally, we will provide some information on how you can follow the meeting discussions, and we'll briefly look ahead to the World Health Assembly taking place in May later this year. So for those of you who are new to the Executive Board, or for those of us who need a refresher, I'll give a quick overview of what the Executive Board, otherwise known as the EB, is and why we attend. The EB is comprised of 34 individuals representing countries in all 6 WHO regions. These health experts serve on 3-year rotations. However, all WHO member states, or countries to us, participate in the discussions at the EB meetings. They meet twice annually in January and just after the World Health Assembly in May running into June, with the meeting in January having the fuller and busier agenda. During the sessions, member states debate pressing global health issues. Documents submitted for consideration and debate at the EB include resolutions, draft progress reports, and updates on different health topics and administrative matters. Resolutions may then be submitted for consideration and adoption by the World Health Assembly, the main decision-making and governing body of the WHO. So why do we attend? Well, we want to keep an eye on the main issues in global health and influence the discussions that take place, either by providing an opinion on those issues, which we can do through our own statements and side events, or by talking to decision makers who determine the global health agenda. While we are there, we network and build up contacts with officials at Ministries of Health and at missions here in Geneva. We put across our key messages and we highlight how exactly WHF can assist member states. And finally, we use the time at the EB to profile the work of our members. And with that, I'll hand over to Ali, who will talk about some recent changes to the Executive Board's format.
Thank you. Now, as Jeremiah mentioned, there have been some changes to the organisation of the EB this year, following comments made by the new DG, Dr. Tedros, at a special session of the EB that was held in November 2017. Among his comments were that WHO doesn't have a board, the EB is another assembly, it does not work this way. The point that he was mainly putting across was that the EB currently functions like another health assembly, in that many countries make long pre-prepared statements, and this can make in-depth discussions difficult as it reduces the time available for dialogue and debate. And many of you who have attended previous WHO meetings will know that the agenda can regularly be chopped and changed, and often at the last minute. Among the changes that have been made for this EB, therefore, are a new framework for organising the meeting and its schedule. Within this new framework, member states will first adopt the agenda, then have the opportunity to have a dialogue with the Director General in a closed session. They will then progress to discuss what have been termed strategic priority issues, followed by technical issues, i.e. other areas of health. The EB meeting will then conclude with discussions on administrative and governance issues, and finally, matters for information. Another change is a new, more transparent prioritization tool for new proposals from member states who wish to add more topics to those items that are already recurring items on the agenda. This aims to avoid the agenda becoming too bloated and to promote more in-depth debate of fewer items. So, by way of example, at this year's EB, there were 9 additional recommendations for items from countries, only 1 of which was included, 2 have been deferred, and 6 were not included for varying reasons, from that they were not urgent or WHO needed to conduct a longer evaluation. For anyone wishing to read more about these changes, we will provide a link to access all EB documents at the end of the presentation. But what is the relevance for CVD and NCDs? So first of all, country representatives on the EB recommended that the existing item on preparing for the high-level meeting on NCDs at the UN General Assembly should be considered a strategic priority. Traditionally, NCDs have been discussed towards the end of the week, and at this point the agenda is normally running behind. The discussion on NCDs may stretch into an evening session, so it's very positive and encouraging that countries have decided to make this a strategic priority, meaning it will be discussed earlier in the week, and this is obviously extremely timely given the high-level meeting on NCDs coming up later this year. So moving on to the agenda, as I mentioned before, it's a new framework for the EB agenda, and items under 3 have been deemed strategic priority matters, and those under 4 are considered technical items. The first of which we would like to draw your attention to is 3.1, which is the draft 13th General Programme of Work. These top 4 items are those that we will be making statements on at the Executive Board meeting. So the draft 13th General Programme of Work, once agreed, will guide WHO's work for the years 2019 to 2023. And because this is a fairly important item, we will come back to this on the next slide. The next item on which we'll make a statement is 3.6, addressing the global shortage of and access to medicines and vaccines. This is a key area for our advocacy, as access to CVD and NCD medicines remains poor in many places around the world. The WHO's report on this item sets out in quite a lot of detail which actions it can currently undertake, given available resources, and what it would like to do and could do, given additional funding. Our statement therefore calls on member states to increase investment in systems to improve access to services and generic medicines, as this could significantly improve the efficiency and capability of their health spending and ensure that those people living with CVD and NCDs get the treatments that they need. Another statement which we will make will be on preparations for the 3rd high-level meeting on the prevention and control of NCDs in 2018. This, as you may know, will be the 3rd meeting following the 1st and 2nd meetings, which were in 2011 and 2014. This 3rd meeting will represent the halfway point between 2011, the first high-level meeting, and 2025, which is the deadline for the goal of reducing the number of premature deaths from NCDs by 25%. And we will come back to this item in a couple of slides' time. Finally, we will make a statement on physical activity for health. A global action plan for physical activity was originally requested by member states this time last year at the Executive Board meeting, and a consultation process was begun by WHO in August of 2017. For this consultation, we submitted extensive comments which were drawn from our membership. The draft release for this consultation has now been updated for this meeting and includes a number of practical recommendations for different groups such as WHO, governments, civil society and private sector. In particular, in the new draft, we strongly support the revised target of a 15% relative reduction in physical inactivity among adults and adolescents, and that target has a deadline of 2030 to align with the Sustainable Development Goals. The previous draft had an absolute goal of supporting 100 million people to become more active, and we prefer and feel and strongly endorse the percentage target that has now been agreed, which builds on pre-existing targets in the NCD Global Monitoring Framework as this offers each member state a concrete and context-specific national level target to aim for. Our statement will focus on recommendations for the indicators as part of this global action plan, which will be agreed later this year, and WHO said will be agreed by December 2018. In addition to those 4 key items, there are 2 others which we were keen to track throughout the meeting. The first of which is preparation for the high-level meeting on tuberculosis. This could have an impact on the NCD community, as the high-level meeting on TB, it is possible, will be held around the same time as the high-level meeting on NCDs. This could impact on high-level political participation in these meetings. It may increase the likelihood of heads of state attending if they are held back-to-back, or it may force political leaders to choose between the 2 if held at different stages. So this will be a key item for us to follow, as it may impact on our own work. And then finally, the item on engagement with non-state actors. As many of you will know, WHO has developed a new set of guidelines called FENSA, which stands for the Framework of Engagement with Non-State Actors. This framework guides WHO's work with all external organizations, such as civil society, academia, philanthropic organizations in the private sector. And one of our key comments that we'll come back to on the next slide on the general program of work is that it did not mention the implementation of FENSA enough, given how important it is for NCDs that WHO works in partnership with many other organizations. This FENSA is due to be fully implemented by May 2018, so we'll follow these discussions to hear from WHO how that process has been going. So moving on to the draft 13th General Programme of Work. This document will guide WHO's strategy and work for the years 2019 to 2023. Its vision is to promote health, keep the world safe, and serve the vulnerable, and is organised under 3 strategic priorities, which are universal health coverage, health emergencies, and healthier populations. Now, NCDs apply in all 3 of these areas, but have been placed as one of 5 platforms under the priority healthier populations. The previous draft of the General Programme of Work was discussed at a special session of the EB in November, which was organised specifically to discuss this item. At that meeting, Member States were generally satisfied by the previous draft and the fact that it aligned with the Sustainable Development Goals. They were also keen on its emphasis on impact rather than outputs. There were some concerns among Member States, however. Many raised the issue of WHO becoming more operational in balance with its normative work. This is in reference to WHO's plan to act as a last resort service delivery provider in extremely fragile health systems. Similarly, there was some disagreement on the plan for WHO to become more decentralized and to shift more capacity to its country offices, with some countries more supportive than others. One of WHO's main responses to Member State comments, and this is a call that has been reiterated in the current draft, is for Member States to provide more unearmarked funding for WHO so that they can prioritise and plan more easily. In his closing speech at the EB in November, Dr. Tedros noted that the WHO manages over 3,000 grants, which can create a lot of administrative work and slow their work down, especially at a time when many different health sectors are trying to work together. From our own perspective, our main comments were in reference to the impact framework. We were concerned that there were no NCD treatment and health systems targets, and therefore recommended the inclusion of a target for 80% coverage of NCD essential medicines and vaccines. In the current draft, NCDs, as I mentioned, are under one of the 5 platforms under healthier populations. The phrasing of this platform is accelerating action on preventing NCDs and promoting mental health. Some of the features of the new draft include strong language on WHO's plans to speak up against practices that are harmful to health. They include specific language on implementing the Framework Convention on Tobacco Control, and they place a huge emphasis on healthy aging and the possibility of evaluating the effectiveness of the GPW through healthy life expectancy. A separate impact framework has not been released alongside the new draft GPW, as was the case in the previous draft. However, there is a list of 10 outcomes to be achieved, and the fourth outcome from this list refers specifically to NCDs. That is, NCDs prevented, treated, managed, and their risk factors controlled, and mental health prioritized and improved. It's not yet clear how specific indicators will feed into this outcome, but we will attend discussions at the EB next week and keep you updated with developments. One comment which we will make is to suggest language used for the NCD platform to draw attention to the fact that management and treatment of NCDs is similarly important to the already strong focus on prevention under this platform. In terms of the budget, WHO recently released an estimated budget for the GPW, which is that it will cost $10.8 billion over 5 years. It notes that most of this additional funding would go to WHO country offices. And then finally, in the draft resolution, which accompanies the new GPW 13, the Executive Board is asked to approve the General Programme of Work and to recommend it for adoption at the World Health Assembly, while the Director General is asked to report back on its progress at the World Health Assembly from the years 2019 to 2023.
So the next item of interest to us is the third UN high-level meeting on NCDs. As Ali mentioned, this meeting will be held in 2018. We believe it will take place alongside the UN General Assembly in New York City in September, though this is yet to be scheduled or confirmed. So our partners in the NCD Alliance are still advocating strongly for this. The second high-level meeting in 2014 set 4 time-bound targets to be achieved by 2016. These were to set national NCD targets for 2025, develop national multi-sectoral policies and plans to achieve the national targets by 2025, to reduce risk factors for NCDs for the Global Action Plan for the Prevention and Control of NCDs, and to strengthen health systems to address NCDs through primary health care and universal health coverage. Progress towards these goals has been insufficient and uneven. For example, the NCD Progress Monitor for 2017 noted that only 94 countries, that's 48%, had implemented operational multi-sectoral strategies to address non-communicable diseases. It is perhaps for this reason that the report makes an urgent case for action on NCDs. That's the report that accompanies this item at the Executive Board. It uses language that is much more direct and to the point than previous reports on the same topic. It outlines the barriers to progress on tackling NCDs in 5 areas. Those are political choices, health systems, national capacities, international finance, and industry interference. It also draws attention to political disagreements between member states on the best buys or Appendix 3 list of interventions, industry interference itself, and the calls by low and lower middle income countries for increased official development assistance for NCDs that have been ignored. The report stresses that if member states do not reach consensus on a political document before the third high-level meeting, then the current situation will only get worse, describing it as the last opportunity for member states. So what will be decided at the high-level meeting? The outcome document will be negotiated in advance of the meeting by country missions to the UN in New York City, with support from their national ministries of health and missions in Geneva, which generally have more health knowledge. WHF is supporting the NCD Alliance's process priorities for the high-level meeting. These include a regional preparatory process. This is to gain a better understanding of governmental priorities to inform the outcome document. The NCD Alliance is also calling for a UN civil society task force to help represent civil society's views to the President of the UN General Assembly and help decide the format, the theme, and processes for any hearing. A civil society hearing at least 2 months before the high-level meeting, so the latest being July for a September meeting. And this would need to be this far in advance so that civil society recommendations could be added into an outcome document. And the final process that is being asked for is high-level political participation. We want ministers and ideally heads of state at this meeting. NCDs are a political issue crossing sectors, and we need political leaders to attend and participate to make NCDs a national priority.
In terms of the NCD Alliance's priorities, they have also set out priorities for the high-level meeting for member states to focus on, which were agreed at the NCD Alliance Civil Society Forum in Sharjah in December. There were 6 priorities that were identified, which were to boost NCD financing, step up action on childhood obesity, tax unhealthy commodities, save lives through access to NCD treatment, put people first, and accountability for progress, results, and resources. There are 2 of these priorities which we felt deserved particular emphasis. Firstly, to save lives through access to NCD treatment. As we mentioned on the access to medicines item, shortages and stockouts of essential medicines remain a persistent challenge for NCDs and CBD in many settings. Studies have shown that over 70% of CBD patients in low and middle income countries do not receive medicines to manage their chronic conditions, and this can rise to over 80% in some low income countries. And this is despite the fact that many interventions involving generic CBD drugs are listed as cost-effective interventions in the WHO PEN package. And for this reason, we feel strongly that increasing equitable access to CBD and NCD services is a top priority for the high-level meeting. Secondly, we think boosting NCD financing is essential. The WHO report on this agenda item notes that NCDs have been the largest underfunded program area in WHO's program budget in percentage terms. It further notes that calls by low and lower middle income countries for official development assistance for NCDs have been ignored. Despite causing almost 70% of deaths worldwide, governments and donors have not responded with sufficient funding to tackle NCDs. We therefore believe that increasing financing for NCDs is a vital step to reducing the global burden and improving people's lives and well-being.
So that was the content, and I'm sure that you will see in their agenda there are plenty of issues being discussed that have implications for heart health. But now to some of the practicalities. How can you follow the EB? There are several ways you can stay updated with ongoing discussions. You can view all meeting documents, the preliminary timetable, and an updated daily timetable online. There's a link on this slide. On that same page, there is a link to follow the meeting via live stream, and that will become available shortly before the first session. You can also stay updated via our website, members news, or via the WHF Twitter feed. At the end of the executive board, the advocacy team will put together a document listing the key outcomes and decisions from the meeting, and we will share those with you. We thought we'd also look ahead briefly to the World Health Assembly in order to flag one key issue which will form a large part of our advocacy work in the coming months. As you may know, through an initiative WHF co-founded in 2014, RHD Action, we and our partners have been campaigning for a resolution on rheumatic heart disease for the past few years. On the 1st of June 2017, at the 141st Executive Board meeting, governments recommended a resolution on rheumatic fever and rheumatic heart disease for adoption at the World Health Assembly in May 2018. The RHD Action team will be relaunching our campaign in February this year, 3 months before the World Health Assembly, as we advocate to governments to support the adoption of the resolution in May. We believe that the resolution will have an incredible impact on the fight against rheumatic heart disease, and we encourage you to find out more and support the work that's taking place. If you are interested to find out more about the resolution and its implications, or to support the advocacy efforts, please do contact us via the email address on the final slide. And that leaves me just to say thank you very much for joining the webinar. We do hope that you found it useful and practical. If there's any feedback that you would like to share with us, then please do. We do welcome your feedback. So if there are things that you think we should change or include, then please send us an email to the address on your screen. And with that, I'd like to thank Ali for the preparation of this webinar, and thank you, and we wish you a productive executive board meeting.